And continuing on with some body mechanics here. So if your loved one is in bed, we're going to be watching a few videos on repositioning your loved one in bed, moving your loved one up in bed, techniques for correct ways of getting them out of bed. But just a few key things to keep in mind here. Most of you will have the normal beds at home that are not remote, but if you do have a remote bed, such as in a hospital, for example, bed in highest position just means how high off the floor the bed can go. Lowest position, how low the bed goes towards the floor. Your bed should be in the lowest position in case your loved one falls out of bed. But there are many different bed positions if you have the remote bed. One of the best positions for breathing actually is going to be a semi-sitting position, which is basically the head of the bed moved to a 45-degree angle. Probably the most efficient way for your loved one to breathe. Sometimes doctors will recommend different positions that we call orthopedic positions. For example, leaning over on a table that goes across the bed, like the table that they would eat from that goes right across the bed and they lean onto it. That's a orthopedic position for breathing as well. Obviously, if it's a doctor's order, you would follow that. But I think the semi-sitting position, 45-degree angle for the head of the bed, is a good position for breathing. If you have a remote bed, you can keep that in mind. Now, we should be changing our loved one's position in bed at least every 2 hours. It just means you turn them onto their side, you turn them back to their back, you turn them onto their other side. And we should be doing this change of position every 2 hours for circulation and to prevent any types of skin breakdown, causing the different types of pressure ulcers that we're trying to avoid. So that's a change in position. Some people call doing that maneuver a log rolling technique. That is just simply log rolling your loved one onto their side or onto their back. We're going to see a video on that. Also, we're going to see a video on moving up in bed. If your loved one slowly starts to slide down the bed, this could be caused from raising the head of the bed if you have a remote one, and you want to move them back up into bed safely. Again, you don't want to get injured, so we're going to be looking at proper techniques and your own body alignment for doing these maneuvers. Moving your loved one to the side of the bed, we should be doing that whenever we're providing care, personal hygiene, oral hygiene to our loved one. We want to move them closer to us. Obviously, the less we have to reach, less chance of injury. So moving to the side of the bed, we do for personal hygiene measures. When we're getting our loved one out of bed, we want to sit them at the side of the bed first, like we're going to see a video on that one. And we call that technique dangling the legs. Their feet do not touch the floor. They remain sitting on the side of the bed first until they get their faculties, their thinking back in order, and they're able to stand up when ready. And we're going to see a video on that one. So sitting and repositioning positions, we want to keep in mind the best way to do these different types of maneuvers and the ways we change our loved one's position in bed. Very important for us to learn these different skills that we're about to see in these videos.